What is an IV vitamin infusion? IV vitamin infusion therapy is a strong tool to help boost the body's immune system and improve overall health and wellness. When the body is healthy and the immune system is strong, they can better fight off ailments such as the common cold and the flu. NIVA Health IV vitamin infusions can provide the nutrients your body might be lacking at 100% absorption rate. Our IV infusions can help fight off infection, combat fatigue, repair cells, strengthen bones, and boost metabolism. The effects are felt almost immediately, and our signature IV therapy combinations can rehydrate your body, boost your immune system, promote wound healing, and even increase energy levels. We offer 3 specialty infusions that include the Myers cocktail. This vitamin infusion is a cocktail of several vitamins and minerals that have extensive health benefits, including enhancement of the immune system, reduction of fatigue, help with seasonal allergies, along with many other benefits. We offer a super immune boost infusion, which helps defend your body from the common cold or flu, among many other health benefits. Vitamin C and zinc support a healthy immune system, reduce the risk of age-related eye diseases, and help in wound healing. NAD is the coenzyme form of vitamin B3, better known as niacin. This infusion is a promising therapy to help you feel young and rejuvenated. This can help your skin glow, boost your metabolism, promote better sleep cycles, and aid in making your bones and joints feel younger. Let the professional team at NIVA Health assist you on your journey to better health and a longer, happier life.
My name is Tom McManus. I am 50 years old. I've been an athlete most, if not all, of my life. Grew up playing all sports, soccer to begin with, and basketball, baseball, football. Played football, tackle football from the time I was 9 till the time I was 30, finishing the last 5 years with the hometown Jacksonville Jaguars, which I'm really proud to say. Still very active in physical fitness, whether that's doing a lot of cardio, mostly running, a little bit of biking. I do a lot of stretching, and I do some weightlifting still, push-ups, pull-ups, and that type of thing. Overall, I feel good. You know, I mean, obviously there's wear and tear. I had a ACL reconstruction of my right knee back in 1997, which I fully healed from. And in 1999, I severed my peroneus longus tendon underneath my right ankle, which was pretty tragic. It severed almost all the way through. It was 90% torn after the injury, and that was the last time I played football, organized football, that is. So overall, feel pretty good. Just I played middle linebacker, so I hit a lot of people. The good Lord gave me this big old melon to be able to do that, and I used to have a 22-inch neck. It's much smaller these days, which is good, but just a lot of wear and tear, a lot of discomfort, you know, neck. A lot of times the back of my head gets tight, and then it trickles down into, you know, down my neck and in between my shoulder blades. Nothing where it's, you know, debilitating. I can't do anything, but I always have to try to stretch it. I'll ice it. I'm a big believer in ice. I would sit in a ice cold tub every day if I had access to one, and sit there for a long time, because I do enjoy that. But yeah, overall, pretty good health with a little bit of pain and discomfort throughout the day.
What is PRP therapy? It's a form of regenerative treatment that involves the injection of platelet-rich plasma directly into the affected area of your body. These platelets, along with the growth factors found in your own plasma, promote recovery and the regeneration of ligaments, tendons, and sometimes even cartilage. During your appointment, we'll take a blood sample and, using a centrifuge, separate out your platelet-rich plasma. Once your PRP is prepared, a simple injection into the injured part is all that's required.
I'm Dr. Foss. In today's video, you're going to learn about the many possibilities and benefits of PRP. So you can decide if PRP can help you get back into action faster and potentially avoid surgery. Platelet-rich plasma, that's what PRP stands for, has become increasingly popular in our clinics in the last several years. And so if you're an active adult that's dealing with, let's say, joint pain or like a slow healing surgery, listen super closely. In the last 2 decades, PRP has become known for its ability to treat a whole host of soft tissue injuries, including ACL tears, carpal tunnel syndrome, golfer's elbow, IT band syndrome, pitcher's elbow, plantar fasciitis, and post-surgical or after-surgical recovery assistance, shin splints, sprains and strains, tendinitis, tennis elbow, even used in aesthetics for beauty, for faces, reconstructing, naturally reconstructing breast tissue, lips, regenerating your hair, and even sexual health. We can improve that for men and women by applying PRP to that area. It's really amazing how you can take the body's super healers, super concentrate them down, and basically just put them wherever you want in the body. I mean, it's a pretty incredible thing. So I can tell you PRP was popularized in sports medicine because of how effective it is. And it really helps players get back into the game really, really fast. And you know how important that is, right, for them. But it has also proven to be just as effective with helping our patients get back to their everyday activities that they absolutely love to do. And PRP works by first drawing on your own blood. So you'll take out your own blood. It's then spun around super fast in a centrifuge. And what happens there is we separate out all what we call the growth factors, right? These are the rich regenerative factors that your body has inside to help you heal. So we super concentrate that, right, out of your blood. And a lot of times we'll concentrate it up to 10 times the power that is currently existing in your blood. And we can just put that wherever you basically want, right? And it's injected right into the area of injury. So this actually causes these growth factors to signal your body to step up the healing in that area. And because of this versatility, the treatment is even being used, for anti-aging facials, for cosmetic lifts, for breast lifts, without having to undergo a facelift or a similar surgery. Pretty amazing stuff. And all the celebrities, of course, using all these regenerative techniques that are super natural, super effective, and can be repeated without any sort of side effects. So after we've performed thousands of these PRP and stem cell combination injections in our clinics, here is exactly what you should consider when deciding if PRP is right for you or for a loved one.
I'm Dr. Joseph Dupont, and I am a retired surgeon from France, as you may have guessed from my accent, right? And I moved here in Florida, in this beautiful and warm country, back in 2018. I retired from my activity in France at that time, and I moved with my sparkling lady to spend some good time here in Florida. But I was affected at that time with a nasty rheumatoid arthritis condition that was creating so much pain in my elbows, in my shoulders, in my low back and neck that I had to stop all of my activities. I was cross-training 3 times a day. I was biking back and forth to my clinic every single day, and every weekend, every Friday, every Saturday, I was going to dance with my sparkling lady from 8 to 12 nonstop. So I was in pretty good shape. And due to this rheumatoid arthritis condition where my immune system was literally attacking my joints, I was in serene pain despite all of the attention I was getting from my doctor colleagues back in France. All they were able to do for me was to slow down the progression of the disease that was only getting worse and worse over time. So I read about regenerative medicine and stem cell therapy, and then I registered myself in an international convention down in Dallas, where I met Dr. Foss. We had a very good connection together, and essentially he told me, just come to our office here in Jacksonville and we'll see what we can do. So sure enough, I was there, and I received stem cells in my elbows, shoulders, low back, and neck, and I also got an IV. And 2 months after, only 2 months after, I was back to the man I used to be. I could dance, I could run, and I could do all of my preferred activity to the intensity level that I used to do. So for me, it was like getting back to life.
So a lot of patients will come in to see us after receiving recommendations to have surgery, right? And they're seeking treatments like PRP and stem cell injections as a surgical alternative. And a lot of other people will come in to see us after they've already had surgery, to ensure a more rapid and thorough recovery. And so there really is no one-size-fits-all solution, and you'll want to address your specific case with a trusted, experienced care provider. So if you're considering having a treatment, here's a few tips on selecting the right clinic for you. Number one, you want to choose quality and reputation over price, right? You'll want to do some background research on your provider to ensure that they're reputable and they adhere to both local and federal guidelines. At NIVA, we have found PRP and stem cell combination therapies to be extremely effective. And we're going to discuss in these future videos exactly how that works. So stay tuned, because we're about to go through that. And just remember, this isn't about a quick fix. This is about providing lasting pain relief and recovery. So make sure you do your research, right? And work with a clinic who's willing to sit down with you and discuss exactly what your goals are, so we can outline all of the expectations for you before you have to make a decision. Thank you so much for joining us today. I'm Dr. Foss, reminding you to live your absolute best life.
My name is Chris. I'm from Livonia, Michigan. I'm 22 years old, and a few months ago I got PRP in my knee.
And how much pain were you in, and for how long?
I was in pain just about every day. I work in a warehouse, and near the end of the day I was limping, and it was hard to move around.
And from a scale of 1 to 10, how much pain were you in from 1 to 10?
Every day was probably about a 7 or 8.
Okay. And what would you say your pain level is now since you've had it?
Now I'm feeling no pain. Maybe a 1, like occasionally, but...
And what would you say to someone who is on the fence about getting treatment? Would you say go ahead and do it?
I definitely would say go ahead and do it.
Awesome. And how is your life different now? Are you able to move around and all that?
I am able to move around much better and really go to work and do what I was able to do before I had this knee pain.
Perfect. Well, thank you so much.
All right.
Hey guys, so I'm really excited because I'm gonna get my stem cell hair regrowth treatment. As you can see right here, Dr. Foss is thinning out. I got thinning happening all up in here. Really accelerated in the last couple of years. So we're gonna go ahead and inject stem cells throughout here, and we're gonna see what happens. So today's the first day. I've had so much, stuff done, dentist office, and I've had,
stem cells injected in my back and my wrist and my ankle and everything. And usually everything feels pretty good, but this is just nothing. I mean, it's so comfortable. You know, I heard microneedling your head is torture, but this is just this is a pleasure. So I just got stem cell for hair regrowth, and I mean, I feel wonderful. I feel great. The procedure was pretty much painless, and just feel really good. And there's no bruising, no swelling. Feels fantastic, and I can't wait to see the hair start regrowing. Hey everybody, welcome. If you're watching this live or if you're just watching a replay, I just want to really thank you guys for joining us. Today, I'm going to be sharing with you the results of my treatment for hair regrowth here at NIVA Health. So over the last couple weeks, we've been sharing with you information about hair regrowth and how NIVA Health has come up with a way to actually mix PRP with stem cells together to literally regenerate and regrow the hair follicle for hair regrowth. So as a lot of you guys know by now, I myself have been struggling recently over the last few years with some hair loss. And we've been providing some videos about my journey. So if you haven't seen any of the videos yet, you can absolutely watch them in the link down here below. So let's do a quick recap. So about how PRP and stem cells together can actually revive your hair. So PRP, also known as platelet-rich plasma therapy for hair loss, this is actually a three-step medical treatment, right? Where the first thing we do is we draw your blood, then we process it, we spin it, we get all the growth factors out, and then it's actually injected right into the scalp. So it can help to heal bodily tissues. This includes the follicles from which your hair actually grows. Now, PRP injections, right, what they do is they trigger natural hair growth. And, you know, this is maintained by increasing the blood supply to the hair follicle and increasing the thickness of the actual hair shaft. So now what we use is we use umbilical cord mesenchymal stem cells. Now, these have the capacity to actually trigger a regenerative response. So when this is delivered to the site, the stem cells have the power to heal by stimulating the repair, the renewal, and the regeneration of healthy tissue in the area naturally. So I myself began these treatments back in December, and I can tell you I've been absolutely blown away at the results. Literally, I can feel my new hair like growing away, which I'm going to discuss with you in a second. Now, we've all seen the ocean of options out there, and it's really natural to feel skeptical. But for me, I can tell you with time and my hair running out, I knew it was time to take action. I had to do something. And so I could tell you that after 12 weeks of treatment, right, as you can see right here, you know, this is all new regrowth happening. And I can tell you people are stopping me saying, hey, you look really healthy. I mean, when you have a whole bunch of stem cells and PRP injected into your head, into your scalp, I mean, that is just, it's just going to rejuvenate and make everything look super young. So even with a mask on, I've been wearing a mask a lot. People are still seeing, you know, the forehead looks healthier, the hair, everything is thicker. It's wonderful. So now this doesn't happen with every single case, but in most cases we can produce, you know, meaningful results. Hair regrowth isn't just important for guys. It's not just men, right? It's also extremely pertinent for women. So if you're suffering from hair loss related to like postpartum conditions, you know, hormone imbalances, or just basic hair loss, this might work for you as well. So have you ever heard the saying that it's not real unless you actually speak it out loud? Well, if your hair is thinning, you know, time is not on your side. So I want you to take some action today because, you know, if there's no hair at all, it's not going to regrow. But if it starts to recede, that's when the regenerative process can really kick in and save those hairs and thicken and rejuvenate and regenerate those hair follicles. So a great thing for that. I want you guys to comment below and let me know what your thoughts are. Share with me and with NIVA Health how you're actually dealing with your hair loss. So what kind of treatments have you tried? You know, did they work? How did they work? And what would it mean to you to get an opportunity to try our hair regrowth treatment? I want to thank you guys for watching. I'm Dr. Foss, and I want you to live your best life.
Every process that is performed in our body is controlled by electricity. The nervous system acts as our body's natural electrical wiring network and is composed of billions of specialized cells known as neurons. Sensory neurons transmit signals to the brain from different parts of the body using electrical impulses known as action potentials. Motor neurons transmit signals from the brain to tell muscles what to do. So, what happens when the nervous system is disrupted? Peripheral neuropathy is a common disorder that affects approximately 25 million Americans. Worldwide, 8% of all populations are affected. It occurs when peripheral nerves are damaged. Typically, it's caused by diabetes, trauma, toxic exposures like chemotherapy, or has no known cause. Nerve damage can cause chronic pain, numbness in the hands and feet, and balance problems. These debilitating symptoms greatly impact the patient's quality of life. Foot drop is an example of a neuropathological condition in which the foot cannot be elevated due to motor nerve damage. This is a debilitating disorder that can lead to falls and injury. Traditionally, drugs such as morphine and oxycodone are prescribed to patients to manage painful afflictions. These potent substances do not work for neuropathy and can be addictive. Drugs only paper over the symptom of pain, but do not heal the damaged nerves which cause it.
My name's Terry, and I came to NIVA Health looking for help for the neuropathy in my feet. And that's exactly what I found. Probably about halfway through the treatments, and the balance that I had lost because of the neuropathy, my ability to work in my cabinet shop, even to walk across the grass in the backyard, was gone. But since these treatments, my balance is back. I'm not using my cane anymore, and I've already recommended this to my son-in-law, who's having problems with his knees. So the staff is great. Come and see for yourself.
Hi, my name is Martha, and I have neuropathy. My father has neuropathy, and I don't want to be like my dad. Fortunately, I heard about Dr. DuPont, went to a luncheon, and liked what they had to say. So I set up a consultation with NIVA, with Dr. DuPont, and he felt like that the treatments that they would provide here would reverse my neuropathy. I was very excited, so I signed up, and I'm about halfway through with my treatment, and I'm beginning to feel some feeling in my feet again, and I think that's encouraging for me, and hopefully by the end of my treatment, I will no longer have neuropathy. I would recommend NIVA to my friends and families. I know they have other programs here for health, men's health and women's health, and I would encourage folks to come check it out.
My name is Mike. I heard about this NIVA on the radio because I was having a problem with neuropathy and my balance. So I came down here and this doctor devised a plan for me. So I'm about halfway through it, and it's helped. I feel a lot better when I first came. And I would recommend this to anybody in my family, anybody that has any problems like this. Thank you.
Yeah. My first name is James, and I have that neuropathy feet. And it bothered me so bad that I saw it in the paper, and then so I decided to come, and I think it's helped me a good bit. And I would recommend it, yes.
My name is Jackie, and I came to NIVA Health because I had problems with peripheral neuropathy, and I had exhausted many other treatments that were provided to me, so I thought I'd give this a try. And the staff here has been awesome. They're all friendly. They're all on a first name basis. And I'm about halfway through my treatment, and I've had some good feelings from the whole process at this point.
My name is William. I came to NIVA Health because I have neuropathy in both feet, and the doctor so far has helped me. I'm halfway through with my treatments, and I seem to be progressing nicely, and I would recommend NIVA Health to your family and friends.
My name is Margaret, and I came to NIVA Health because I have neuropathy in both of my feet going up my legs, and my very first impression with this company has been so wonderful. Everybody's been helpful. I call and ask questions. They call me back. They give me the information I need, and they go over everything with. They went over everything with me and my husband, which is important also. And they broke down the complete cost, everything. And everybody here is so nice. You'll feel at home when you walk in. Would you recommend NIVA Health to your family and friends? Yes. I would, in a heartbeat.
My name is Lori. I came here because of neuropathy. The doctor has helped me tremendously, and I tell all my friends and family.
My name is Rosemary, and I came to NIVA Health because I had neuropathy in my feet, and I was looking for an answer, and I found it here. The doctor has helped me, and I would recommend it and have already recommended it to my family and friends.
My name is Leon, and I came to NIVA Health because I had a problem in my feet. And I have to say that the staff here at NIVA has been tremendous. They've been very helpful, very nice, and accommodating. And I would recommend the service for anybody. They're great. Thank you.
Let me take you on this basically journey that you'll typically receive at a typical medical practice. And so a lot of times the next progression is what's called a cortisone shot. And this is a corticosteroid injection. What this is designed to do is it is designed to remove inflammation from your joint. Okay, so what I want you to ask yourself is, why is the inflammation there in the first place? Well, the inflammation's there because you've got some sort of a dysfunction, right? There's the inflammatory response, and that inflammatory response just basically says that something isn't right, okay? That inflammatory response also releases pain. That's why you experience the symptom of pain, right? Pain is your body trying to tell you, hey, something isn't right, right? And the inflammation is actually designed, our bodies are designed to be super healers, right? We're supposed to heal ourselves, right? That's how biology and that's how human beings are, right? You cut yourself, there's inflammation, your body, you don't think about it, right? Your body just automatically knows what to do. And what does it actually do? So your body will actually send growth factors to the area where there's a problem and start to repair, right? It takes your body's DNA and it says, oh, I know it. That's a skin cell. I got to fix it. That's a blood cell. I got to fix it. That's a nerve cell. I got to fix it. Same thing happens with your knees, right? If you tear a ligament or you start damaging your cartilage, if you're young and you're healthy, your body's got inflammation. It sends the growth factors over. It repairs it. Everything's fine. You're back. You're back on enjoying your life, doing whatever you're doing. But as you start to get older, as your cells start to get older, that inflammation and the growth factors that are attracted to that inflammation, they no longer respond the way they used to when you were younger. So your body is not able to really fix the problem like it used to fix it. And so that pain is nagging and it's frustrating. And what a lot of doctors' offices do, we don't do this at our office, but a lot of offices will do what we call cortisone shots. And those cortisone shots, they remove the inflammation, they get the inflammation out of there. But here's the thing that maybe some doctors won't tell you about cortisone shots. if you do some research and you do some homework, there's some very prominent medical universities out there that educate that you should not have more than 1 cortisone shot in one area of your body in your lifetime, okay? Which is, unbelievable, because I've seen people come into our office where they've gotten, 10 cortisone shots in their lifetime. Now, let me explain to you what cortisone does. When you inject cortisone into your knee, what that's doing is it removes the inflammation. Well, remember, the inflammation was there for a reason. It had a purpose. It's there to help you fix the problem. So if you remove that inflammation, what do you think is actually going to happen to your knee? Let me explain to you what we do here and why we do it. The first thing that we do is, we understand how the body functions, and we want to support your body healing itself so that you can prolong the health of your joints, and I know we're talking about knees today, so let's be specific with the knees. Now we've taken away the inflammation, but you still don't have much of a joint space. So what do we do? Like it doesn't hurt as much, but you still have a little bit of a degenerated joint that doesn't have a joint space. So what we can do is we can actually inject what we call hyaluronic acid, HA for short, or viscosupplementation. And what it is it's kind of like a gel-like injection that goes in between your knee joint. And what that does is it creates a space. That space is kind of like a cushion. It's like, thank you, right? Create a little bit of a space. And then now you can walk, right, with more of a space. It's not like this or it hurts, right? And you can actually start to walk or ambulate a lot more comfortably with less pain. And you're actually, because of the space, you're obviously, because it's not rubbing together as much, it's causing less inflammation. So that's great that we're creating that space. But now how do we actually support that? So another wonderful therapy that we offer is there's a specific type of knee brace that you can wear, okay, which will support your knee after you've had the hyaluronic acid, where it's increased the space. You wear that brace to then start to stabilize, okay, the joint, so that your muscles can adapt to basically your new, knee. And so those 3 are absolutely wonderful. Now, another option that we offer, which is really like a higher level option, is in regenerative medicine, is stem cell therapy. So we can also add as a supplement to all these therapies actual cells that come from the placenta, that come from the umbilical cord, from the Wharton's jelly, that are mesenchymal stem cells. They come from the placental tissue, from the amniotic fluid. And it's a combination, it's a complex, again, it's an FDA cleared tissue and cells that we can inject into that knee, right? And help to actually, those are the very, very powerful growth factors, cytokines, all the good stuff that your body really needs to repair and regenerate the damage and the degeneration that's been there for so many years. So if you really want an impactful treatment, if you really want something that's going to give you the highest chance to avoid that very dangerous knee surgery, that knee replacement surgery, where the statistics on knee surgery are pretty scary. And that's really like my passion and our team at NIVA Health's passion, is to help people avoid surgery at all costs. I mean, if you can avoid going under the knife, if you can avoid anesthesia, the risk associated with it, the cost associated with it, a lot of times our procedures will actually cost you less than going through a knee replacement surgery, because the deductibles and everything are so out of control these days that you're better off coming here, because you're actually going to get a better level of care. It's going to cost you less, and you're going to get to keep your own knee. If you look up knee replacement surgery, or if any of you guys out there have had it, because I can tell you that it's not fun. I can tell you, there's one lady that I sat with once. She came in for a consultation. She had seven failed knee replacement surgeries. I mean, this poor woman, my heart was pouring out. I couldn't believe it, and she was still in pain. I mean, it's not fair. And so, obviously there's no guarantees with anything in medicine, but that's why you always want to start with the safest and most conservative thing first. Start there first and see if you can get a result. Okay, if you don't, then you can get a little bit more invasive. And so here at NIVA Health, we're going to be able to take you through this progression
to give you all these options and to evaluate you and to work with you step by step every visit to make sure that you're seeing results and that you're happy with those results and that you understand what's going on with your knee and you understand what we're doing and how long it's going to take for you to start to feel better. I mean, that's just like really, really important for us to have total transparency so you can totally understand what you're getting yourself into, and that's really the knee journey that we can offer you here at NIVA Health.
I'm George Gardell, 73 years of age, and I'm from South Lyon, Michigan.
And about how much pain were you in and for how long?
I've had trouble with my right knee for probably 8 to 10 years, and then quite a bit of pain on a regular basis. Going up and down stairs was a real problem, especially if I had something in my hands or my heavy lunch bag on my shoulder. That knee would give me difficulty going up the stairs, and I'd wind up losing my balance. So.
All right, and what type of medications were you taking to help cover up the pain?
Well, there wasn't just pain in my right knee, unfortunately. I take tramadol and Tylenol, extra strength arthritis, because of other issues that I have. But I no longer take any pain medications whatsoever for my right knee. It just, like, there's no problem there at all at this point.
What would you say to someone who is on the fence about getting treatment?
Oh, definitely do it. It's the best thing I've ever had. I've had major back surgery before. I've had bypass surgery, and surgeries are something that I would definitely put off as long as I possibly could. But this is such a simple procedure, and it works so well. I would recommend it to anybody.
And what did you enjoy about your experience here at our office?
Oh, the people here are great.
And how is your life different now?
It's really different when you consider that I haven't got out and exercised yet for any distance, but I want to start walking again in the park. And going up and down stairs is much easier for me, less chances of taking a fall and that type of thing. So it's changed my life quite a bit.
That's awesome, George. Well, thank you so much, and we appreciate you giving this to us.
Thank you. I appreciate what you've done for me.
My name is Joe Artime. I am a very active individual for a person of my age. From the beginning, when I came in here to do my first procedure, my pain level was somewhere about 8 or 9.
Wow.
Maybe even higher. I could not go downstairs, I could not go downhill, and I couldn't even pedal a bike. The pedaling of the bike on my right knee was sufficient pain for me to stop. I did not have the range because of prior surgeries, so I wanted to do something that was evasive, and this was the best solution.
Non-invasive.
Non-invasive, excuse me, non-invasive. Yeah. After the first treatment, I was able to go down. I have a 2-story home. I could go down the stairs from the second floor to the first floor and not have to hold on to the rail. And to me, that was the first test. Prior to that, I was holding on to the rail for support, and that wasn't me. I go, how could this be happening? Going upstairs was not a problem. The counter of that is going up the stairs, I could almost do a jog going up the stairs instead of stepping on the steps, on each step, one at a time. I could actually run a few and get there faster. From an activity level, I could now play basketball just to shoot around and run because there's still more procedures to be done. There were 5 treatments. I'm close to the end. People in this facility educated me well enough, and my pain level right now is probably somewhere between a 2 and a 3.
Wow.
But I would recommend this to anyone that is still active and is looking for a non-invasive process that will help them to continue being active for a longer period of time.
Attention men, ready for a drug-free, non-invasive solution to enhance function and performance? Hey guys, it's Dr. Raphael Foss here. I've been a distinguished leader in the field of wellness, lifestyle programs, natural pain treatments, and cutting-edge regenerative cell medicine therapies, including anti-aging and men's health. I'm here today to talk to you about solving your situation in the bedroom. Are you tired of taking medication and all the adverse side effects that come with that? Have you been worried about invasive treatments to solve your ED? Well, I can tell you 52% of guys between 40 and 70 experience ED, but many don't get treated. Let us at NIVA Health help you. At NIVA Health, we offer the best non-invasive treatment for men's issues with our GainsWave machine. GainsWave has been used to treat ED, Peyronie's disease, and can improve a man's sexual performance. This can be done by addressing the root cause of ED. With GainsWave treatment, we use low-intensity extracorporeal shockwave therapy. So this actually means that we're using high-frequency acoustic waves where we can go out and open up the blood vessels in the area, stimulate the growth of new blood vessels, and eliminate microplaques. So GainsWave works for you. In your time, no injections, no implants, and no medication. Putting a Band-Aid over something with stitches sounds super silly, doesn't it? This is very similar to ED and taking that little blue pill. Best of all, this safe and effective treatment is available for men of any age. So stop relying on pills and dealing with all the accompanying side effects that come with this. Regain your confidence and live your life with vigor and with vitality that you used to have. Remember how things used to be. Remember that confidence that you used to have. You know, that's really important. Our goal here is to help you live your absolute best life. So contact the regenerative medicine professionals at NIVA Health and ask about GainsWave therapy for ED. Look, ED happens, but it doesn't have to stop your life. Give me a call today and schedule your complimentary consultation and let NIVA Health help you live your absolute best life. So are you wondering, should I be taking an over-the-counter sexual enhancement pill, or should you guys come in and see us at NIVA Health? Well, firstly, a lot of guys out there, there's a lot of unwanted side effects, and the drug world calls this, side effects. For example, severe headaches, congestion, systemic blood pressure issues. So the big difference between taking drugs and what we do is drugs are temporary. So they're there to mask the symptoms. So the symptom being ED. So most likely it's like putting a piece of black electrical tape over your red oil light in your car. So, what we do is we actually get to the root cause of your ED issue and fix the problem without drugs, without surgery. Doesn't that make so much more sense? So you're wondering what it feels like to come to NIVA Health and experience an ED visit. So let me take you on this journey with us. So come on with me. So the first thing that we're gonna do is you're gonna come on in here. We're going to have a seat, and what we're going to figure out is how much blood flow is actually flowing through the penis. This is what's going to help us determine how severe the situation is. So we do a what we call a Doppler. That's going to help us measure the actual blood flow that's flowing. It's a non-invasive procedure. It's very simple. It's very quick. And from there, based on your medical history, the information that you give us on that one-on-one conversation that we're going to have in this room, we will be able to determine if you're mild, moderate, or maybe you're severe. And then from there, that will help us guide you and recommend a specific personalized care plan. From there, you can basically start your first visit usually on the first day that you come in for your analysis. So it's really simple, and the treatment itself is only about maybe 15 to 20 minutes max. So let me show you some of the things that we're actually going to go through when you come in for your ED visit. So this right here, this is our Doppler. It's basically an ultrasound, and it's non-invasive, doesn't hurt at all. And this helps us determine blood flow. So when we're determining blood flow, that tells us, if you're mild, if you're moderate, if you're severe. We'll also take a full history, get to know exactly what your symptoms are, what you're experiencing.
so that we can make a good determination on how severe the condition is. From there, we're going to recommend a very personalized care plan. And our main treatment that we utilize is the GainsWave technology. So we use this machine right here. And so we're able to really explain to you exactly, what's going on with your specific situation. This right here is the gold tip from GainsWave. It's an acoustic sound wave device. It's a Class 1 FDA cleared device. And basically, you're coming in and this thing is on for about 10 minutes. And what we do is we go up and down the penile shaft. And what this does is it actually increases blood flow. So the main issue that causes erectile dysfunction, here's the big secret, it's decreased blood flow. So when the blood is not flowing properly in the penis, as you age and you degenerate, or you're taking a bunch of medications and your body's dealing with stress and things like that, the amount of blood flow that flows to your penis decreases, and that really affects erection, sexual pleasure, being able to finish and all these, maintain an erection and all these functions. So by treating you with our GainsWave technology, we're able to break up all the plaque that's in the blood vessels in your penis. And basically what that does is it basically reverses time. So it's the anti-aging for your penis, so that you can start performing the way you were performing when you were a lot younger. And we're noticing that usually after several treatments, we start noticing, we get positive feedback that, hey, I'm noticing some really nice changes. And then from there, we actually encourage our patients to, after they come in from their first visit, to go home and try to have sex. And so that's really the goal. And so our success rate is super high. I can very proudly say that we really we don't want to overpromise, but I can tell you that we stick by you until you get the results that you come in for. And so it's really about making sure that you end up getting the kind of result that you want here. Of course, not every single person is a candidate. Some people do wait too long where it gets too degenerative, and this non-surgical drug-free option is no longer an option. But when you come in, we will be honest with you and we'll let you know if you are going to be an excellent candidate for an ED patient here at NIVA Health.
Hi, I came to NIVA because I have had ED really, really bad from some drugs that they gave me in the VA. The staff here is fantastic. They're very friendly. They go out of their way to make sure you're comfortable and everything goes fine. We had the treatments are really not invasive and they're not bad at all. It's pretty good. This staff makes sure that you are satisfied. I have come back wonderful from it. I think it's a great thing. If you should try it, because it's not anything that be ashamed of. It is really, really a help. And I would tell anybody to come here and try, because it's the staff and the treatments you get are wonderful.
Okay, so what brought you into our office to begin with?
I work out and was having really bad pain in my knee and subsequently in my wrist from carpal tunnel.
Okay.
But primarily my knee. I was having some pretty bad pains while I was working out. So
where would you say the pain scale was on 1 to 10? 1 is very mild and 10 severe pain.
At any point in time, while I was working out, it could range anywhere from 5-ish. After I worked out, that pain could radiate up to an 8, 9-ish.
Wow.
It would cause me to limp. So yeah, it was pretty discouraging.
Where would you say the pain is now on that pain scale?
Oh boy, if I push my workout, maybe 2-ish. I mean, that's just, I don't have any of the limping anymore, but I'm definitely squatting in my workouts with no pain.
And it's been how long since you've gotten the stem cell injection in the
I
right
just
knee?
went over 6 months on Monday.
That's amazing. 6 months, and about how much percentage would you say better?
Oh, probably 80%.
80%, 6 months.
So one of the other areas that I was starting to have some pain in after I had surgery done on my wrist was doing a push-up. Became very painful. I would actually have to shake my wrist out, like halfway through. I'd have to pull up, and just kind of, I have no problem with my wrist. So if you want to say percentage-wise, my wrist is like 100% now. I have no pain in that whatsoever. I had just had a little bit of an injection in my wrist. Most of it went into my knee, but that I would say is hugely successful. So now I do push-ups. I don't have any problem with my wrist. Modern medicine, how can you not want to take advantage of something that could help you improve your quality of life? So
Great
for
answer.
me, it's been well worth the investment.
Hi, I'm Angie Harper. I came to NIVA Health. I had been in severe pain for several months with some rib pain, and I'd seen many doctors and I went to the emergency room twice, and they were unable to treat me. They did a lot of testing and couldn't find any reason or anything that that they could identify as a problem. And so I was just going through, they actually did recommend physical therapy, and so I had been going to that, and I was getting worse every day that I went. And I was at my wit's end, and when you're in pain, you have a lot of pain at night, and I had a really hard time getting through the night. And so I was looking on the website, Googling, trying to diagnose myself. So I went, I found NIVA Health, and I put my information in, and just thought, well, it can't hurt. And so I did that, and they contacted me the next day, and so they invited me to come in for a consultation, and I did that, and I met with the PA that actually gives the injections, and then I met with the physician here who gave me a personal testimony. And I was very skeptical, because I'm kind of a skeptic anyway. And my husband is the opposite. He is a very optimistic person, so we're the perfect match. But so I met with this physician, and he gave me a personal testimony of what he had been through. He's from Europe, and he had terrible, terrible pain all over his body from arthritis, and was just disabled. And he was at his wit's end with pain pills and all this kind of stuff. So he gave me a great testimony, and I said, this is the thing, I'm going to do it. I just totally wiped away any hesitations I had. So I came in, and I had the first stem cell. I had two bottles, or whatever, of it. And it's expensive, but it was so worth it for me. So and they did the PRP along with it. Had the first treatment, and I wasn't instant, but within a week. And I'm telling you, I had been suffering with no improvement for over 2 solid months. No improvement, nothing. And so I immediately started to get better and better and better. And it just, within a month, I was like, it was just so decreased, the pain. And then by the time I came back for the first PRP, because you have the stem cells first, then you have the PRP, I purchased 3 treatments of PRP after. So I had the stem cell, and then I came back in for that. By the time I came back, which was a month, I had no pain at all. I could tell where it was. It was almost like I knew where it was, exactly where the pain had been. But it wasn't hurting, but it was just almost, I could tell you exactly where it had been. After that second PRP, I have had no pain. It's gone. I don't even know where it was. In fact, she was asking me today, tell me exactly where it is. And I'm like, well, it was in this general area. So I'm so happy that I found this, and I took the chance to try something new. And I would encourage anybody to do it, and because I've had a wonderful result. And really, regular physicians, or whatever the right term is to say, doctors have not been able to help me, regular medicine. And just, I mean, it was like they would tell me, well, it could take 6 months, it could take a year for you to get better because this is an intercostal area. There's not a lot of blood flow to the area. And so, and that's one of the good things about the injections is it calls, the stem cells call a lot of blood to come to that area to transport those stem cells. So that helped a lot, and I believe that's why I'm healed. So I'm just so happy, and thank you so much. I wish you all the best.
Hi, my name is Dolores Bracker, and I came to NIVA Health because I had bone on my right hip. It was very painful, and my daughter actually recommended I come here, and I came for the stem cell treatment, and I just had my treatment for the radio waves, and it has been great, and I'm feeling better, and it's just my second week. So I would highly recommend you, if you have these problems, to look into NIVA and invite your friends or family. The staff here is very pleasant, very welcoming, and if you have any questions, they'll take the time for you. Thanks much.
So tell me, your name, sir?
JD.
And what brought you to NIVA Health?
I'm sorry.
What brought you to NIVA Health?
My shoulder is the main part.
Okay.
My neck.
And have they helped you with your shoulder and your neck?
Yes, sir.
Oh, excellent.
Last week I couldn't do this.
Excellent, excellent.
Could not do that.
And you're here again for another treatment?
My neck.
Okay.
Mainly my neck, and probably another shot in my shoulder.
Excellent, excellent. And would you recommend NIVA Health to your friends?
Anytime I would. Any day and any time.
Excellent, excellent.
It's the best thing that ever happened to me.
It's not just about weight or getting people healthy.
I feel just amazing, and I feel more confidence than I felt in a very long time.
You know, I didn't feel like I was that overweight, but now I'm like, wow.
Since I've lost 51 pounds, I no longer need my sleep apnea machine.
My goal is to make sure that everybody gets to experience this amazing technology. We want to let everybody know that we have a natural, sustainable solution for your health.
Being overweight and working in healthcare, you know what you're supposed to do. You just know it. But you don't always do it, and you see these patients that they need the same support of, you need to lose weight, this is what you need to do, and it's so hard to tell somebody that when you know you're not living the lifestyle you're supposed to either. So that was another moment that was like, I need to get on track. Hi, I'm Nick. I am 28. I am a registered nurse. I have been for 6 years. I was a full-time staff nurse for about 2 years, going on 3 years, became a unit leader on my nursing unit, became part of management, which turned into a lot of sedentary work. There was a lot of scheduling, dealing with administrative issues, and I wasn't as active as I was either, so that didn't help. I would get out at 5, 6 o'clock at night, didn't want to do anything at that point, didn't want to cook, didn't want to go to the gym. And then probably about 2, 3 years later, I decided I didn't want to do this anymore. It wasn't fulfilling me the way that nursing did, so I went back to the bedside. Only this time I decided to do travel nursing. So currently I'm traveling about 2 hours away from home. So on my days off, I drive home, stay for a couple days at home, then go back to work for a couple days. So there's a lot of traveling involved, and it just makes it very difficult to plan your meals, cook. It's so much easier to just drive to work, order something when you're there, order something on the way home. So it took a lot of motivation out of me to do anything that was generally healthy at all.
Hi, my name is Karen. I'm a 66-year-old widow. I am a registered nurse working in a palliative oncology unit. I never had a weight problem my entire life. I've always been thin. Even after I had 4 pregnancies and gained a lot of weight during those pregnancies, I was able to take that weight off without any problems. Once I reached mid-age, I began to struggle more and more with weight issues because of hormones. I think I attribute it more to stressful situations in my life, some depression, and so I began to yo-yo with my weight. Sometimes the stress alone would make me lose a lot of weight, probably in an unhealthy kind of way, but the stress just led to that. Then I would put some weight back on because I would be depressed or bored or studying, which sometimes led to boredom. And then I would start snacking in the evenings a lot. But I noticed most of my life when I would snack and binge like that, it was never a problem. My metabolism would just take care of it. But as I got older, I noticed that metabolism did not work like that anymore.
Weight loss programs for me, they've never really seemed like a great idea. It always seemed like a gimmick. Never really thought it was anything they really wanted to put any effort into. I've always tried to do it myself, just knowing what to eat, trying to eat the right things. Prior to starting travel nursing, about 3 months ago, I had to get a physical to start again, and the physician assistant said to me, you are overweight. That's the one thing that I would take from this, that you need to lose weight. And it really hit me, like that was the first time that I really thought, oh crap, I'm really overweight. I mean, no physician, no PA, nurse practitioner has ever said to me, you need to lose weight. And that's when I realized I needed to do it.
Okay, I've tried a lot of different programs, diet programs, pretty much on my own. Even tried getting a Weight Watchers book and trying to do that on my own, counting calories. What are some other things? Some online products that I wanted to try. Just telling myself I can regulate my eating, I can put my portions down. I got my NIVA journal and I've been looking through it. I'm really excited about it and how I can journal each day about what I'm eating, what time periods I'm eating. And that's another thing I really like about NIVA is the intermittent fasting that is included in this, because I do think that's something that really works for losing weight. So I'm excited to get started with this journal as I track my journey with my weight loss, and hoping that it's not going to be a short journey like my other diet plans, but that this will be a journey that ends up being for the rest of my life. In my pack, I got some Hawaiian salt, which I know this type of salt is really good for you, diet-wise and healthy-wise. One thing that happened to me recently was when I turned 65, well, 2 months before my 65th birthday, I woke up in the morning and had what I thought was really, really bad indigestion. Turned out I was in the middle of a heart attack. So thank God I knew the warning signs and was able to reach out to family to get me to the ED in time. So that was a real eye-opener for me, because I had no warning signs prior and have felt great since. But turns out I knew I had high cholesterol issues and had just started taking some medication for that. But lo and behold, without too much warning, a heart attack came upon me and I had a stent placed. So eating properly is even more important for me now. So I know I need to take some weight off. I know weight is important for cardiac issues, as well as a really good diet and keeping my cholesterol the way it needs to be. Salt is an issue for somebody that has cardiac issues. So using the proper kind of salt, and you can use limited amounts, much less with Hawaiian salts than you do regular salt. So that's a really good thing for me. We have multi-greens, which we all know greens are important for us. I like vegetables. I like green vegetables, but not everybody likes them. So this is part of the program, or these multi-greens, which are a plant blend. Water drops. This is to put in some water. Even though we're to drink a lot of water, sometimes we just fight it and we don't want to drink the water. So if we put a little bit of flavor in, that will help, and there's no sugar in these. Then we have the molecular hydrogen, which helps with your pH balance in your body, to make sure that everything is working well. Like when your body's not working well, then even weight loss isn't going to go well. So you want to get your body into such a good, healthy state of being that it will aid in your metabolism. This is the VitaLife formula, which these are drops that you're going to take. And this is Mineral Life, some more liquid, sort of including minerals into your body, making sure the mineral balance in your body is where it needs to be. So I'm hoping with improving this diet and getting on these good supplements and maintaining good mineral balance, pH balance, and vitamin balance in my body will help not only maintain the health that I have, but also prevent any future problems that I might have. I've also been labeled as a pre-diabetic, so with the cardiac issues, the high cholesterol, the diabetic issues, it's time now. I mean, I had enough warning signs now that I know I need to do better.
Hi, Lori. How's it going today?
It's going great, Michelle. How are you?
Good. I'm good. Good. Thank you. Good to see you. Looking thinner and fabulous. Congratulations.
I am feeling amazing. This program has literally changed my life. Like, you know, we've talked before about how I've tried so many different programs and literally nothing has worked for 5 years. So I can't believe how much weight I've lost, and in like the short amount of time that I've done it. Like, this is crazy.
That's wonderful. I'm so excited for you. And I know it wasn't easy, so I just want to commend you and all your hard work. You really stuck with it and the results show, so congratulations. And now you've made it to the Live On stage, so that's very exciting. How much weight total did you lose?
I've lost 23 pounds so far. I would love to lose a little bit more, but I think that's really going to go within, you know, the Live On steps and standards. So
absolutely, absolutely. There's a lot of different options of losing on your own a little bit in the Live On stage, or when you're ready and you've had a break and a rest from the detox, you can go right into a shorter round. So whatever you're ready to do. But yes, Live On is great. You've now finished stage 3 to where you've reset fully. You've stayed within the 2 pounds of your weight set point, which is great. So you've learned how to add some foods back in. Did you have any trigger foods in stage 3 that you're aware of?
I did. Some dairy, okay. I noticed.
Which isn't uncommon, actually. A lot of people do.
I was very surprised by that. Just a lot of bloating, actually. And I also noticed an emotional kind of trigger to it. So it seemed like I got a little bit more anxiety, some strange feelings, even hormone issues. So definitely going to start avoiding dairy again. I think that was
dairy. And that's, you know, that's good that you realize that too, because there are going to be some foods that you may either want to avoid altogether after this, or if you do have them, you're just going to know that if I eat this trigger food, then I know the next day I'm probably going to have to be doing a protein day or an apple day and get myself back on track. But that's great of the awareness. So that's awesome. Well, I'm excited that you're improved your health and got through this program and had such amazing results. Live On stage is the best stage because now that you've developed all these healthy habits, the idea is to not go back to the way we were living before, right? Because if we go back to all of our old bad habits or foods that we were eating before, then of course, eventually you're going to gain the weight back that you just lost over time. So we don't want that to happen. So really you just want to take the tools that you just learned from stage 2 and stage 3 and apply them now to your everyday cooking, to your everyday foods that you eat, and focus on eating, 90% of the time you want to be eating those healthy whole foods, proteins, vegetables, and fruits. Don't get away from that, continue up with those amazing foods. And then we also recommend supplements during this time too. One of the reasons you felt so great while you were on the program too wasn't just the healthy eating. It was also all of the herbs, vitamins, minerals that you were taking in with the supplements provided that got the hydration up and kept you in that great energy state and sleeping good. So a lot of that was the minerals that you were taking. Have you completed all of your supplements that you had?
I still have a couple more, but I actually plan to order them again because I even noticed there were several days that I didn't take the supplements, and I could even feel the difference in that throughout my day. So I definitely plan to keep on them. And is there any that you definitely recommend to keep using?
Yes, for sure. So we always recommend the fizzy tablets for life if possible. They are just so incredibly great at keeping your immune system up, reducing inflammation, and helping the hydration levels. As well as I recommend the green caps. It's a great multi-green to stay on for your daily vitamins there. And then another one that's really good to stay on for men and women is one called Adaptogen when you move to this stage. It's a great vegan supplement that actually adapts to your daily stressors in life. So it's a really good one to stay on because it can not only reduce inflammation, but it can just keep your body at a balanced level throughout the day. So those are the 3 main ones. And then, it's case by case after that, depending on if clients still have some health issues that they're working on, or if you aren't sleeping well, or whatever the case might be.
If I wanted to continue, meeting with you, Michelle, or, going through this in the Live On, are there options there?
Yes, absolutely. And we actually encourage you to keep your monthly membership so that way you can stay accountable because yes, 60 days is over. It's been 2 months, but honestly, it takes sometimes a little bit longer for clients, and we don't want you to fall back into any of those bad patterns or habits. So it's great to meet with a health coach, once a week, twice a week, whatever it is that you need for support. Whether it's, via, Zoom like this or in person if you're near one of our locations. And just to know somebody's got your back. And if you're having, a rough day, you can call your coach and like, hey, talk me out of this or whatever it might be. And also for the Facebook page, I think you've been very active on our Facebook members page, and it's great because then there's recipes that are always being put up there by clients. There's questions you can ask, and everybody's just so supportive of one another. It's just like one big family on there. So it's important to stay connected because as soon as you get away from something for too long, it's easier to fall back into those old habits.
I think it's been super supportive of you and everything that you've done, part of my journey. I really appreciate that. And even the Facebook group, it's been amazing. The community there, everybody's just responding and participating. And anytime I had any questions, everybody just kind of chimes in, and it just really felt like we were in it together. So I really thank you for that and appreciate that. I just had one more question before we go. How would you recommend introducing some increased exercise to this? And should I take some steps getting into it or watching for any inflammation or anything like that?
Absolutely. So we actually highly do recommend getting into some sort of exercise regime. It doesn't have to be, CrossFit or anything, but even if it's for 10, 15 minutes a day, whatever level you can do, whether it be, HIIT exercises or going for a bike ride every single day or walking, a certain amount of time every day. If you're a runner, yes, incorporate, adding some running back in. Now, granted, if you haven't been doing anything for the last 60 days, you want to slowly, work your way back up to your intensity level. So start small, do 10 minutes and see how your body does. Maybe the next day add 20 minutes. foods, you know, so you're going to have to listen to your body. You are going to be, obviously at this point, you're eating a bunch of healthy fats, you're eating foods at a higher calorie count to where you're going to be able to do that sustained workout now. So you should have plenty of energy. Coconut oil is great, especially when you start working out again. Make sure you're getting coconut oil in every single day. It just is great for burning fat, but as well as keeping that metabolism going strong and giving you that sustained energy as well.
That's awesome. Thank you so much, Michelle. I really appreciate it.
Of course. Congratulations again, and look forward to talking and seeing you again soon.
All right, thanks.
You're welcome. Bye-bye.